Bobby, autism, if I could.
Hey, so you may have seen this recent clip from a cabinet meeting where Trump and RFK Jr. are talking about autism. My name is David Tillman, and I'm a public health professor. I'm also the father of a son with autism. And I published research on environmental exposures in autism, and I've spent years working alongside families and scientists and the disability community. And the language in this is harmful and the data is misleading. So as I take a walk this morning, I just thought I'd respond to some of the things in that video and hopefully put some things in perspective as we talk about the history of autism numbers, what the science really tells us about the rising rates, and why vaccines are not the cause, and what real researchers are actually talking about in terms of these environmental risks. Let's start here.
Autism is such a tremendous horror show, what's happening in our...
Now, when I hear autism described as a horror show, I just can't let that pass. I want you to think with me for a minute about the weight of those words. Calling autism a horror show suggests that the life of my son and millions of others is somehow terrifying or grotesque. And that way of talking didn't start today. For centuries, people with disabilities were treated as freak shows that were literally put on display for entertainment. And this kind of language doesn't treat people with autism as full humans with dignity and humor. And our family story isn't characterized by those words at all. The genre is not horror. It's more of a dramedy, maybe. It's human. And I just want to start from the place that reminding us that words don't just describe reality, words help shape reality.
In 1970, the biggest epidemiological study in history was done in Wisconsin. They looked at 900,000 children and they were looking for autism. They knew what it looked like and they were very, very precise about it. And they found an incident rate of 0.7, in other words, less than 1 per every 10,000 children.
So let's talk about that 1 in 10,000 number. RFK is pulling that from a 1970 study done in Wisconsin by Dr. Daryl Treffert. Now, Dr. Treffert was an incredible pioneer in autism research. He sort of took the baton from Leo Tanner, who also did some important work. But I want you to understand that these folks are psychiatrists, and they're trying to understand what was considered to be a childhood psychosis at the time. When this study was done in 1970 and up until 1980, a decade later, autism was considered to be, get this, a subset of childhood schizophrenia. Now, Treffert went looking in the hospital and clinic records across the state for that, for a subset of schizophrenia, and found a rate of 3 in 10,000. And you might say, well, RFK said 1 in 10,000. There were 3 types, A, B, and C, that Treffert was counting. If you look only at A, the rate is 0.7 per 10,000. But as you can see here for yourself, when you combine A, B, and C, the rate that Treffert reports is 3.1 per 10,000. So even that was incorrect. But here's the thing. Was autism really that rare back then? Of course not. The methods were just incredibly narrow. Autism wasn't widely recognized at the time. Most kids who today would clearly meet the criteria were given other labels back then. As I mentioned, childhood schizophrenia, but also developmental disability or mental retardation. So if you only count kids with that profound situation in 1970, you're gonna get a small number. And Treffert himself in this study warned about this. He said his study was limited and likely missed cases. If you look at other studies from that same time, by the way, in both the US and in Europe, they report rates of more like 4 to 5 per 10,000. So even those are way below today's numbers, but they show that 1 in 10,000 was never the story. Not in 1970, it was never the story. So when people like RFK compare that one Wisconsin study to today's CDC data, it sounds dramatic. It sounds like autism has exploded out of nowhere. But the definition changed. Awareness changed. The diagnosis itself changed. So if you only go by Treffert's count in that one study, you're setting up a misleading comparison from the very start. And the real question isn't why did it jump from 3 in 10,000 to 1 in 30? It's how much of that change is better recognition and how much of it might reflect a true rise. And that's a great question that scientists have been working on carefully for a couple of decades now.
Today, our most recent numbers are 1 in every 31 kids. It's probably actually much worse than that.
So if I asked you to count the apples in a grocery store, would you only count the red delicious apples? I'll come back to that. RFK Jr. points to this study done in Wisconsin back in 1970, where Dr. Daryl Treffert found not one, but roughly 3 children had autism out of every 10,000 kids. And yes, today, that number is more like 1 in 30. So if you do the math to convert it to per 10,000, that's like 330 kids today out of 10,000 kids have autism. Let's see if we can visualize that. There are the 3 checks for what Dr. Treffert's study would have found out of the 330 we would find today. But here's the problem. That number was already way too low. Other studies in the 60s and 70s in both US and Europe found that 4, 5, or 6 kids per 10,000 had autism. So let's update the count there and add another check at least. But then scientists started doing something that Treffert couldn't do, looking at outpatient records and full school and health system data instead of just who showed up at a psychiatric hospital. A study in Denmark found that just including outpatient records alone would explain 42% of the increase in autism rates over the decades. 42%. But that's still missing kids who were misdiagnosed back in the 1970s. Kids labeled as schizophrenic or having mental retardation. With today's tools, we would count those as cases of autism. And then think about other things that have changed in our society that aren't bad, but affect autism rates. For instance, preterm birth is a known risk factor for autism, but babies who were born earlier are much more likely to survive today. And advanced maternal and paternal age. People today are much more likely to have babies later in life, and we know that that's a well-documented risk factor for autism. And here's the big one. Treffert was only counting the most profound cases, but today we recognize that autism affects people along a whole spectrum of disability. So with these changes, all of a sudden now we can account for almost 2/3 of the increase. Science already can explain roughly 200 of those 330 kids. Now what's left in those gray dots at the bottom? That's where scientists are still asking questions, and they're important questions. But when you hear RFK compare, quote, 1 in 10,000 to 1 in 30 today, remember, it's not apples to apples. It's more like back in 1970, we were only counting red delicious apples, and today's count represents the whole spectrum of apples.
Think of those numbers. So there has to be something artificially causing this, meaning a drug or something.
So in the last video, we saw that about 2/3 of the rise in autism can be explained by things like awareness, parental demographics, diagnostic criteria, and survival. But that still leaves a third unexplained. And I think that RFK Jr. might think that that hasn't been explored by scientists. But the truth is, scientists have been digging into that for a long time. One of the people who's led the way is Dr. Irva Hertz-Pichota at UC Davis at the Mind Institute. She launched 2 of the largest and longest studies in the world on autism and environmental factors. The CHARGE study, which is childhood autism risk from genetics and the environment, and the MARBLE study, which follows younger siblings of autistic children from pregnancy onward. So for decades, these studies have collected biological samples, medical histories, and data on exposures from everything from air pollution to pesticides to chemicals in everyday products to exposure to pharmaceuticals and vaccines. What's powerful about Irva's work is the scale and the patience. Thousands of families have been studied, followed carefully over time. And these studies have already identified important exposures that matter. For instance, prenatal exposure to air pollution, or those PFAS or forever chemicals you might have heard about. They have been linked to higher autism risk. These are findings that have been replicated across studies. I even had the privilege of collaborating with Irva. Our team looked at common medications like acetaminophen or Tylenol and NSAIDs like ibuprofen taken during pregnancy and whether that elevated autism risk. Other folks have looked at prenatal inflammation or protective factors like folic acid. The point is that these are real scientific questions that have been asked and are being asked with real data sets that are hard to build. But the heartbreaking part is that just as this work is giving us useful information, it's being undercut. Pollution controls are being rolled back, even those chemicals that studies have already linked to autism. RFK's administration has cut funding for researchers like Irva and Aaron McCanley's, who've done the most promising work in this field, building huge data sets over time. So the real story is not that nobody's been looking at or asking these questions until RFK showed up. If we care about that unexplained third, then the path forward is clear. It's to keep investing in the charge and marble studies of the world, not in press conference promises.
We will have announcements as promised in September. We're finding certain interventions now that are clearly, almost certainly causing autism.
If you can find out the reason that that's happening, I think we maybe know the reason.
So when Trump says, I think we already know, let's be clear. He's dog whistling vaccines. And the idea goes back to a single study in 1998 by Andrew Wakefield. And here's what you need to know. That study was a fraud. It was retracted. Wakefield lost his medical license because of it. He was found to have doctored the data and having attempted to hide his financial conflicts of interest. He stood to make millions off of this. It wasn't just a bad study. It was an intentionally misleading study that was motivated in part by greed. And most people are shocked to learn that this study, which is the reason so many people link autism and vaccines, had a sample size of 12,000? 1,200? No. 120? Y'all, try 12. 12. And what was the link that was suggested? That vaccines cause colitis. He was a GI doc, and the colitis caused autism. You remember all the celebs screaming about colitis and autism? No, that's because their imagination was captured not by the data, but just by the idea that these shots were poisoning children. It was never true. It has always been a fraud on the day it was published, but it has led to many deaths already. And because of all of the attention, scientists have taken the concern seriously. They have asked the question again and again, is there any link at all between vaccines and autism? And after dozens of large, carefully designed studies across millions of children and across the world, the answer is consistent, y'all. There is no link. Meanwhile, vaccines have saved millions of lives. Measles, polio, whooping cough, these used to kill or disable children in staggering numbers. We can't let autism be weaponized against vaccines.
And I look forward to that press conference, to be with you in that press conference. That's going to be a great thing.
When I hear someone say we'll have a groundbreaking report in September that explains the autism epidemic, I just shake my head. That's not how science works, y'all. Here's what real science looks like. In studies like the Marble study, the Charge study, researchers spend years recruiting families, collecting blood samples, running genetic tests, measuring environmental exposures, analyzing health and education data. And then we publish our results. We go to conferences with other academics. We submit to peer-reviewed journals so that other scientists can hear and read and critique and even try to replicate our findings. That's the goal, to get your findings out where they can be tested and challenged. Because if it can't hold up to scrutiny, it doesn't hold up at all. You can't just decide in May that you're going to deliver a bombshell report in September. There's actually a name for what you're seeing here. It's called science by press conference. It's when people skip all the hard work of evidence building and instead roll out flashy announcements that are meant to grab headlines. We've seen it before in Wakefield's study, by the way. It looks exciting in the moment, but it misleads the public, it erodes trust, and it leaves families like mine shifting through confusion instead of clarity. If we really want answers to these questions, we don't need science by press conference. We need data. Transparent, replicable, accountable. We need science that families can trust. We need to invest in that kind of work.
Because there's something wrong when you see the kind of numbers that you have today versus 20 years ago. Thank you, Bob. You're doing a great job.
So we've walked through a lot here, and I want to end this series on a personal note. Because for me, this isn't just about fact-checking a cabinet meeting. It's about my son and the community of people affected by autism that we get to belong to. Because his life is shaped significantly by autism. And every day, families like mine face the challenges, also the joys that come with it. And when leaders call autism a horror show or hint at vaccine conspiracies, I feel that not just as a public health professor or researcher, but as a dad. And here's something that happens every time I speak about vaccines online. I get accused of getting kickbacks from pharmaceutical companies. Let me just tell you, the truth is I've never received a dime from pharma, like most everybody I know that talks about this kind of thing. Not one penny. During COVID, I volunteered at mass vaccination events. I went around to church fellowship halls and just answered people's questions about the vaccines. I did it not because I was getting one single penny from a vaccine company. And it's not just me who gets accused of these things. We're being told now that pediatricians are only encouraging vaccines because of the pay, because of the money. This could not be further from the truth. My mom was a pediatric nurse and later a pediatric nurse practitioner. She wasn't getting rich from anything, but especially from vaccines. But she always encouraged vaccines with her patients. Why? Because she knew and she saw firsthand how it saved children's lives. It wasn't about profit. It's about protecting her kiddos, her patients. So let me end with this. I absolutely welcome all the attention that autism can get. Let's keep studying causes. But let's also put energy into making the world better for people with autism and kids like my son through services and inclusion and support. And if next month's big report tries to blame autism on vaccines, I hope you stand with me in rejecting that, because it's worse than a distraction. It's the opposite of what families like mine really need. So thanks for taking this little walk with me through all the history and data and facts and fiction. And I hope this was helpful to you, and I hope we can work together to make this world a better place for kids like my son.